So what is facial transformation by any plastic surgeon? So we get many clients in our office for the facial consultation. So she has come to me for a consultation. For facial transformation, we always do the cocktail of treatments. Like in this patient, we have done 4 procedures. So first is the micro fat grafting. Second is the nano fat grafting or the liquid fat, and third is the skin tightening by invasive radio frequency, that is called face tight, and last is the laser resurfacing for the skin. So we assess the face from the upper one third, then middle one third, the lower one third. So what I advised her to make her more beautiful is the fat grafting. So as you can see, under the eyes and in the anterior cheek there is loss of fat, and that gives a sad or the aging appearance to the face. So we are planning for the fat grafting for the whole face. So we are planning under the eyes, that is tear trough area, then the nasolabial folds, interior part of the cheek, and some little fat on the highest point, and the marionette lines just below the lip to raise the corner of the lip. We are doing the in the upper eyelid to raise the upper eyelid, then the temples, and we are doing nano fat on the forehead and the upper lip and the chin. So this is the advanced treatment. So nano fat contains the stem cells, so it takes care of the fine wrinkles and some pigmentation on the skin. And the denser fat, we centrifuge the fat, and the heavy fat we use to fill the folds, the nasolabial folds, under eye. So we are doing mixture of the fat grafting, nano fat grafting, and the micro fat grafting. Then over the skin we are doing the Morpheus 8 treatment, that is advanced radio frequency induced microneedling. Second is the skin quality, the skin texture. Again, with the fat grafting there is some pigmentation concern, some dullness concern. So with the nano fat grafting we can take care of the skin quality also. We have advised her the fat grafting, and you can see from other pictures also there is significant fat loss under the eyes and in the interior cheek, the nasolabial folds, the marionette lines, the corners of the mouth. So what is the technique of the fat grafting? So first step is we have to harvest the fat either from the abdomen, the love handles, or from the thighs. So we use a low suction power under local anesthesia. We can harvest 40 to 50 ml of the fat. Then second step is the processing of the fat. We have to specially centrifuge the fat, or there are other techniques. We want to condense the fat. We have to discard the water content, the plasma content. So we have to take only the thicker fat. And third step is injection. So with a very small needle hole punctures in the face which are never visible, we have to do the fat grafting in multiple planes. So these are certain techniques which are beyond explanation in this video. So the result. So this is very important because patient is not interested in the technique, she is interested in the result. So you can see she has got a fuller face, and this is the late result after the absorption of the fat. So initially we have to wait for 2 to 3 weeks because 30% average, the 30% of the fat gets absorbed, and this is the late result at 3 to 4 months. Yeah, even we have her latest pictures also at the 2 years of the result. The fat is stable after 2 to 3 months. Whatever absorption is there has been done in initial 1 month only. So this is the final result. So you can, as the patient wanted, she wanted the fuller cheeks and the fuller in the under eye areas. So if you see from the profile view, the face looks very sad, and there is sunken, totally atrophy of the fat in the cheek area and in the under eyes area, and you can see there is a elevation of the cheek here. Similarly from the other side, and this is the 3/4 of the view you can see there is a nicely curvature to the cheek and to the highest point of the cheekbone and to the under eye area. And last and the most important to highlight is just observe the texture of the skin. At 3 months, you can see when there is a plumping of the face or there are stem cells in the fat, or we take the liquid fat called the nano fat and we put it just into the dermis, that is in the skin part only, not in the deeper layers. So it gives the miraculous result for the skin texture. So you can see the skin is glowing, the pigmentation has been reduced, the pores have been improved, and the uneven skin tone or the dull skin also improves because there are stem cells in the nano fat which acts on the dermis or on the skin level. So there are double benefits. So she gets a fuller face, she gets a younger looking face, and the skin has also improved. Thank you.